Well, hello there. You know, sometimes the simplest things in our kitchen cabinets can stir up a lot of talk, can't they? We're talking about that little box of baking soda, the kind you might use for baking cookies, or maybe keeping the fridge smelling fresh. It's so common, so inexpensive, just pennies really. But lately, you might have heard whispers, maybe seen things online or heard from a friend, suggesting this humble ingredient could actually help with some of those aches and pains that seem to crop up as we get a little older. Things like stiff, achy joints, or even something as serious as kidney health. Is there any truth to these claims? And more importantly, if there is, how can we even think about using something like baking soda safely, especially when we're managing our health in our senior years? That's exactly what we're going to explore today. We'll look at what the science actually says, separate fact from maybe just wishful thinking, and most critically, talk about the absolutely essential safety steps you must know before considering baking soda for any health reason. Let's dive right into one of the more surprising claims you might have heard about baking soda: its connection to kidney health. Now, for most of us, we think of baking soda for, well, baking, or maybe cleaning. But it turns out, baking soda, which is chemically known as sodium bicarbonate, does have a very real, very specific medical use when it comes to the kidneys. It's not a magic bullet, and it's certainly not something you should ever try on your own without a doctor's guidance. But in certain specific situations involving kidney disease, doctors sometimes do prescribe or recommend sodium bicarbonate. Why? Because in some people with chronic kidney disease, their kidneys can't properly filter waste and balance the body's chemistry. This can lead to a condition called metabolic acidosis. Think of it like your body becoming too acidic. When this happens, it can make kidney disease worse and cause other problems. Sodium bicarbonate, being an alkaline substance, can help to neutralize that excess acid in the body, helping to restore a more balanced pH level. This is a legitimate, studied medical use. Researchers have looked into this, and for select patients under strict medical supervision, sodium bicarbonate therapy can be part of managing metabolic acidosis related to kidney disease. But here is the absolutely critical, cannot stress this enough point. This is a medical treatment for a specific condition, prescribed and monitored by kidney specialists. It's not a general kidney tonic, it's not a preventative measure, and it's definitely not something you should decide to try because you read about it or heard someone mention it. Kidney disease is complex, and the balance of chemicals in your body is incredibly delicate. Taking baking soda when you don't need it, or in the wrong amount, can actually be harmful. It can mess up your electrolyte balance, which are crucial minerals like potassium and sodium that help your nerves, muscles, and heart work correctly. An imbalance can be very dangerous, especially for older adults who might already have existing heart conditions, blood pressure issues, or other health concerns. Think about it. If you have high blood pressure, adding extra sodium, which baking soda contains a lot of, is usually the last thing you want to do. So, while it's true that baking soda has a role in treating a specific kidney-related issue, it's a role strictly played out in a doctor's office, with careful monitoring and precise dosing tailored to an individual's exact condition. For the vast majority of people, and certainly for anyone with kidney concerns, the idea of using baking soda as a home remedy for kidney health is not just unproven, it's potentially very risky. Always, always, always talk to your doctor about any concerns you have about your kidneys or any other health issue. They can provide evidence-based treatments and advice that are safe and appropriate for your specific situation. Don't gamble with your kidney health. It's too important. This isn't like trying a new recipe. This is about the vital organs that keep your body in balance. So, while the connection between baking soda and kidney health is real in a medical setting, for most of us in our everyday lives, Thinking of baking soda as a kidney helper is misleading and dangerous. The key takeaway here is simple and clear. Leave the use of baking soda for kidney conditions to the medical professionals who understand your specific needs and can monitor you safely. Trying to self-treat can lead to unintended and serious consequences, far outweighing any perceived benefit. It's much wiser to focus on lifestyle choices known to support kidney health, like managing blood pressure and diabetes, staying hydrated, and following your doctor's guidance, rather than experimenting with kitchen ingredients for such a vital and complex organ. Now, let's talk about something many of us deal with as we age: joint pain. Those creaky knees, stiff fingers, or aching hips can really impact our daily lives, making simple tasks feel challenging. Naturally, we look for ways to find relief, and you might have heard or read that baking soda could potentially help with this too, perhaps by reducing inflammation. Inflammation is a major player in many types of joint pain, particularly conditions like rheumatoid arthritis. So, the idea that something inexpensive like baking soda could help calm that inflammation is certainly appealing. There's some early research that looks at how baking soda might affect the body's inflammatory response. Some studies, often done in labs or with animals, have suggested that drinking baking soda might influence certain immune cells, potentially shifting them towards a less inflammatory state. The theory is that by reducing systemic inflammation, it might offer some relief for inflammatory conditions. But, and this is a significant but, the research on baking soda specifically for joint pain in humans is very limited. We're talking about preliminary studies, not large-scale clinical trials that definitively prove baking soda can effectively and safely treat conditions like osteoarthritis or rheumatoid arthritis. Joint pain can stem from many different causes, and what works for one type of pain or one person might not work for another. Relying on baking soda for joint pain could mean delaying proven treatments that could offer real, lasting relief and improve your mobility and quality of life. Things like gentle exercise, maintaining a healthy weight, physical therapy, and prescribed medications have solid evidence behind them for managing joint pain. Baking soda simply doesn't have that level of evidence. Thinking you can swap your doctor-recommended pain management plan for baking soda is not advisable, and could actually lead to your condition worsening or experiencing unnecessary discomfort. While the potential anti-inflammatory properties are an interesting area of research, they are far from being a recommended treatment for joint pain. It's important to manage expectations and prioritize methods that are known to be effective and safe. Don't let the potential buzz around a simple ingredient distract you from seeking appropriate medical care for your joint issues. Moving on to another common use, something perhaps more familiar to many of us: using baking soda as a temporary fix for heartburn or acid indigestion. We've probably all had that uncomfortable burning feeling in our chest after a meal. Baking soda works here because, as a bicarbonate, it's an alkali. When it mixes with the excess stomach acid causing heartburn, it neutralizes it, much like putting out a small fire. This can provide quick, temporary relief. It's a well-known home remedy for a reason. It can work in a pinch. However, it's crucial to understand that this is just a temporary fix, not a treatment for chronic heartburn or acid reflux disease. Relying on baking soda frequently for heartburn can have its own set of problems, especially for older adults. Remember that high sodium content we talked about? Using baking soda regularly for heartburn means you're consuming a significant amount of sodium, which is bad news if you're managing high blood pressure, heart failure, or kidney disease. Also, the reaction between baking soda and stomach acid produces gas, carbon dioxide. This can cause uncomfortable bloating, burping, and in rare cases, If you've eaten a very large meal or have other stomach issues, it could potentially cause more serious problems. For occasional mild heartburn, a tiny amount of baking soda mixed in water might provide temporary relief, but it's far from the best or safest option, especially compared to over-the-counter antacids specifically designed for this purpose with fewer risks. If you experience heartburn frequently, that's a sign you should talk to your doctor. Persistent heartburn can be a symptom of a more serious underlying condition that needs proper diagnosis and treatment, not just temporary neutralization with baking soda. Beyond kidneys, joint pain, and heartburn, baking soda does pop up in discussions about other potential uses. You might hear about athletes using it to improve performance by buffering lactic acid, or people using it for teeth whitening. These uses also come with caveats. The athletic use, often called soda loading, involves consuming relatively large amounts, which frequently leads to significant digestive upset. And while baking soda can help remove surface stains on teeth due to its abrasive nature, overuse can actually damage tooth enamel, and it doesn't address underlying dental issues. The common thread across all these potential uses, kidney support, joint pain relief, heartburn, athletic performance, teeth whitening, is that while baking soda interacts with the body in various ways, using it safely and effectively for health purposes requires careful consideration, often involves risks, and for anything beyond very temporary, mild issues like occasional heartburn, with caution, it's generally not the best or safest approach, especially for older adults. The risks of using it incorrectly or in the wrong situation are simply too high compared to the unproven or temporary nature of the benefits. Now, let's get to the absolute most critical part of our discussion today. Something that cannot be emphasized enough, especially when we're talking about health in our senior years. Using baking soda for health purposes, beyond maybe a tiny bit for occasional mild heartburn, if you have no underlying health conditions and aren't on medication, comes with significant risks, particularly for older adults. Our bodies change as we age. We might have conditions we're managing, like high blood pressure, heart disease, kidney issues, or diabetes. We're also more likely to be taking multiple medications prescribed by our doctors for these conditions. This is where the potential dangers of baking soda become much more pronounced and complex. The biggest red flag with baking soda is its incredibly high sodium content. Just 1 teaspoon contains about 1,260 milligrams of sodium. The recommended daily intake of sodium for most adults, especially those over 50 or with high blood pressure, is often much lower, sometimes as little as 1,500 milligrams total for the entire day. So, taking even a small amount of baking soda for health reasons can push you way over that limit very quickly. For someone with high blood pressure or heart failure, this extra sodium can cause the body to retain more fluid, increasing blood volume and putting extra strain on the heart and blood vessels. This can lead to elevated blood pressure, swelling in the legs and feet, and even worsen heart failure symptoms. It's a serious risk that far outweighs any unproven benefit for things like joint pain or general alkalizing. The body. Beyond sodium, taking too much baking soda can cause severe electrolyte imbalances. Electrolytes like sodium, potassium, chloride, and bicarbonate are vital for proper cell function, nerve signals, and muscle contractions, including your heart muscle. Throwing these out of whack can lead to symptoms like muscle weakness, spasms, confusion, irregular heartbeat, arrhythmias, and even seizures or coma in severe cases. Older adults are more vulnerable to these imbalances due to age-related changes in kidney function and fluid regulation, as well as the potential effects of medications they are taking. Which brings us to another major concern: drug interactions. Baking soda, as a bicarbonate, can interact with certain medications, It can affect how your body absorbs some drugs, making them less effective or potentially more potent. It can also interact with medications that affect electrolyte levels or kidney function. For example, if you're taking diuretics, water pills, for blood pressure or heart failure, combining them with baking soda could dangerously alter your potassium or sodium levels. If you're on medication for kidney disease, adding baking soda without your doctor's knowledge could interfere with your treatment plan or put extra stress on your kidneys. Given the number of medications many older adults take daily, the risk of a negative interaction with baking soda is substantial and unpredictable without a doctor's review. Furthermore, taking large amounts of baking soda can lead to what's called metabolic alkalosis, the opposite of acidosis, where your body becomes too alkaline. Symptoms can range from nausea and vomiting to more severe neurological issues. While rare with small doses, the risk increases with larger amounts or frequent use, particularly if your body isn't able to process and eliminate the excess bicarbonate effectively, which can be the case with reduced kidney function. Another specific concern, if you have any history of stomach ulcers or if your stomach is overly full, the rapid production of gas when baking soda mixes with acid can be problematic. In very rare instances, it could potentially lead to stomach rupture. This is an extreme case, but it highlights that even seemingly simple reactions in the body can have serious consequences under certain conditions. The bottom line is this: there is no safe, recommended dose of baking soda for self-treatment of common age-related issues like joint pain or for general health benefits in older adults. The risks of excessive sodium, electrolyte imbalance, and dangerous drug interactions are simply too high. Any potential benefit is either unproven, temporary, or applicable only in very specific medical contexts under strict supervision. Your health in retirement is your most valuable asset, and protecting it means making informed, safe choices. Relying on unverified home remedies when you have underlying health conditions or are taking medications is risky. Think of your doctor as your expert guide. They know your health history, your medications, and your specific needs. Before you consider taking any new supplement, remedy, or even something as common as baking soda for health reasons, you must have a conversation with your doctor or pharmacist. They can tell you if it's safe for you, if it interacts with anything you're taking, and if there are proven, safer alternatives for managing your health concerns. Don't hesitate to ask. Their job is to help you stay healthy and safe. Prioritizing professional medical advice is the smartest and safest approach to managing your health journey. Taking care of our health as we get older means making smart choices and relying on trusted information. While baking soda is a wonderfully useful item in the kitchen, when it comes to using it for health concerns like easing joint pain or supporting your kidneys, the evidence is either very limited or its medical use is restricted to specific, doctor-managed conditions. The potential risks, particularly from its high sodium content and the chance of dangerous interactions with common medications, are significant for older adults. Your health is unique, and what's safe and effective for one person might not be for another, especially when managing existing conditions. That's why the most reliable expert advice you can get is from your own doctor. They are the best resource to guide you on safe and effective ways to manage your health concerns. Please always talk to them before trying any new remedy or supplement, including baking soda for health purposes. If you found this information helpful and important for staying safe and healthy, please give this video a thumbs up. And don't forget to subscribe to our channel so you don't miss out on more trustworthy health tips and advice designed specifically for you. Share this video with your friends and family. Together, we can help everyone make safer, more informed decisions about their health as they enjoy their golden years.